I'm Dr. John Thomas. I'm an orthopedic surgeon at Lone Star Orthopaedics, and been doing this for about 13 years in private practice. My concentration is in sports medicine, so I did an extra year of training in Indianapolis, and I learned a lot of techniques, arthroscopic surgery of knees and shoulders and elbows and things, and so I usually try to incorporate that, specialize that in my practice, but I also do a lot of general orthopedics, do some joint replacements and some trauma as well. A couple of my favorite procedures are knee arthroscopy. I like to do those just because it's a patient population I like to work with, kind of the weekend warriors that go out like I do and get injured, and they come in because they've done a little bit more that weekend than they should have. And so knee scopes are nice to do because we can get an MRI, look at the problem, see what it is. You usually have people back to doing that same sport or the things that they like to do within a few weeks. It's pretty minimally invasive. We basically go in, make a couple of small incisions, and go find out what's going on in the knee and go take care of that pretty quickly. And depending on what we find, most of the time people will recover and do quite well with that. One of my passions is shoulder surgery. I really enjoy doing rotator cuff surgery. That's kind of another patient population that's more middle-aged people that are either engaged in sports or just hurt themselves doing something that they like to do. And so the reason I like doing that is it's a complex problem. We basically go in and we're reattaching a tendon back where it belongs, and it's a tough rehab. The surgery itself doesn't take very long, but the patient has to do a lot of rehab. And what we find is that it's really encouraging because you take someone that can barely lift their arm, and within a few months they're back to doing everything they want to do. They're doing the sports activities they like to do, chasing their kids around and doing whatever they want to in life. I guess my other final favorite procedure is knee arthroplasty or knee replacement. Because of the technologies that we have and just doing a lot of these, I find that we can really get people that were barely able to do what they wanted to do. They can't chase their grandkids anymore, they can't play sports, they can't golf. We can get them back to enjoying activities. That is much more of an inpatient procedure, and it is more time intensive, but patients generally do very well with that. So I'd say those are my three favorite procedures. I try to really break everything down in very common terms rather than hide behind a bunch of words. I usually just try to break it down and say, this is what I see your problem being, and this is what the solution is. And a lot of times we try to get people better non-surgically, but if they need surgery, we'll try to explain that in a way that makes sense to them and kind of fits to what they were, what they came in and what their goals eventually are to be like. So I want the patients to feel like they can just talk to me, that I'm just a regular guy with a little bit of extra knowledge of what to do with their particular problem. There's a few surgeries that we do that probably aren't that rehab dependent, like if we're going to do a carpal tunnel release or something simple. A lot of times patients can do that on their own, but anything more complex, usually rehab is very important. So we really like to take a team approach. If you were my patient, it would be you and me kind of coming up with a plan and saying, this is my part that I'm going to do, and then you got to do your part afterwards. Because if I don't do my part, it doesn't matter what kind of rehab you do, you're going to do bad. But if I do a good job and the patient doesn't do their rehab, there's a chance for a bad outcome. And so we usually try to, at least I sit down with my patients and say, this is what it's going to be pretty much step by step, probably week by week or month by month. This is what I expect. This is what you expect of me to take care of the problem. This is what I expect of you to do your rehab. This is stage 1 that you have to do. Once you meet those goals, you go to stage 2 and 3, and then so on until you progress and get to the point you want. And everyone's different because, once again, for me, my goals after if I had an ACL surgery would probably be different than my nephew who's 18 and a college athlete. So we have to tailor that to the goals of the patient as well, because every patient is different. And so your case is of course different than a TCU athlete much younger than us, or grandpa and grandma that are older than us. So what we want to do is just figure. I always ask people, how old are you? What do you do for a living? Are you right or left-handed? And just see, and I always want to see how this affects you, because if someone comes in just because their doctor told them, I found this on your MRI and you need to get it checked out, that's a lot different than someone that comes in because they can't lift their kids anymore, they can't play baseball, they can't do what they need to do. So we really try to take a very individualized approach. We want to know about you, how this is affecting you, and then we can come up with a solution as to how to get better, whether that's with surgery or without surgery. So I think rather than have a cookie cutter approach, I think here we really try to individualize it per the patient.